Hello, hello. I thought we needed a little change of scenery, and I'm filming this on a Friday when we don't typically see patients, so I have the place to myself right now, and I can be as loud as I want to. So I'm filming at the front desk. What I wanted to talk to you guys about today is testosterone replacement therapy, specifically in relation to erectile dysfunction. So a lot of people are surprised to learn that testosterone replacement therapy does not help with erectile dysfunction if that's the only symptom, if erectile dysfunction is the only symptom. So what is testosterone replacement therapy? Testosterone first is produced, of course, naturally in the body, and depletion of testosterone can lead to tiredness, low sex drive, even some muscle wasting. So testosterone is very important. And sometimes men are prescribed a series or regimen of testosterone replacement. This can be in the form of pills, patches, gel, and of course injection. Injection is what most people have heard of or are familiar with. So what are some side effects of testosterone replacement therapy? Of course, there can be skin conditions like acne, sleep apnea, non-cancerous growth or inflammation of the prostate, even enlargement of the breasts, and limited sperm production, and even testicle shrinkage. So the side effects aren't great. Why would someone decide to take testosterone or participate in testosterone replacement therapy? Well, a couple of the main reasons are it can help reinstate sex drive. So that's important that's important for overall health, holistic health. That's as an occupational therapist, I can tell you that sexuality and intimacy is one of the main areas of occupation, if you will, or how humans occupy their time. And there's a lot of health benefits to that intimacy and sexual health, which I'll write another blog on after this series. But, okay, so cons of testosterone replacement therapy. Like I said, there's no benefit to people who have erectile dysfunction using testosterone replacement therapy. That's a common misconception. Also, it requires a regimen of medication, however that's delivered, whether it's through pills or one of the other methods that I mentioned. And what a lot of people don't know is when you introduce synthetic testosterone, if you will, it can actually cause the body that's already not producing enough testosterone, it can cause it to produce even less naturally. Because testosterone is being introduced artificially, so the body says, oh, I don't have to produce it. It's already here. I don't need to produce more. And then also, of course, there's no benefit. Some people think that if I take more testosterone, it'll help me be bigger, stronger, better. But there's no benefit. If you're already producing enough testosterone, there's definitely no benefit in increasing that level. Next week, I am going to talk about, that'll be the last in this series of erectile dysfunction and solutions for erectile dysfunction. And we'll be talking about Gainswave. So have a wonderful day. And for me, like I said, it's Friday. So if it's Friday for you, have a wonderful weekend. All right. Bye-bye.